The President's position on this can be summarized in 3 words. Poor children first. Poor children ought to have health insurance before we begin to focus on adults. They ought to have it before we start focusing on middle-income families. The President just thinks it's wrong that some, under this bill, could receive public subsidy for their health insurance as high as $83,000 in their family. We would be encouraging people who currently have insurance to cancel it so that the government can pay for it.
Secretary Levitt mentioned a couple of numbers there, $83,000 in New Jersey.
There's not a single program in the country that has been authorized at $83,000.
Well, New Jersey would go up to $72,000.
It already is. It has been in place for 9 years. It was requested through the department that Secretary Levitt leads under a Republican governor in 1999, Christine Todd Woodman, and it was reapproved for 9 years in a row. And the reason it was approved up to those limits is the fact that the cost of living in New Jersey is far higher than it is in other parts of the country, and it was seemed reasonable, I think, to both Republican and Democratic administrations to give what they call a waiver, and that occurred. Now, the fact is that there's only about 3% of our kids in that 300% of poverty to 350%.
Middle class,
upper middle class, hardly upper middle class in New Jersey. The median income is about $65,000. The reality is that the vast majority of the children that are in the SCHIP program, we call it family care in New Jersey, are under 250%.
But here's what the Wall Street Journal said about your program in New Jersey. There's an editorial called Garden Statism, and you're actually suing the federal government over their plan. Their response is, how fitting that Mr. Corzine should be the one to resort to law-breaking, given that his state exemplifies everything that's gone haywire with SCHIP. States like New Jersey have been taking advantage of SCHIP's flexibility and covering more affluent children, their parents, and even childless adults. And President Bush this week said that New Jersey actually pays more under SCHIP to adults than children.
Well, this is the problem with this whole debate. There's so much misinformation. We cover parents up to 133% of poverty. That's $27,000 for a family of 4. In New Jersey, that is poverty. Matter of fact, people earn the earned income tax credit there. We're giving money back because they don't have enough resources to be able to get by in the world today. Yes, the cost of insurance for adults is more than for young folks, for kids, but that is not going to middle class or even moderate income families. Very low income. It's an extension of Medicaid, and the percentage of young folks, kids that are insured is 10,000, is about 3%. It's 10,700 of the total of 125,000.